Hi everyone. Okay, so this is just a bit of an update on Ross and everything that's going on in our world. It's often easier for me to do it like this because I can kind of do it in one fell swoop. It's not just a message, you get to see how I'm actually seeing things, and nothing can be misconstrued. Okay, so since we last spoke, we were discussing Ross getting out of hospital. Ross has got out of hospital. I think, hang on, where are we up to? I can't remember what day it is, but about a week or so he's been out. Or was it 2 weeks? God, that's bad, isn't it? 2 weeks? No, a week and a bit, a week Thursday, he's been out of hospital. This week has been a bit chaotic because we have been trying to find calm for the girls, so seeing me more has been a big thing. Being able to see me taking them to school, picking them up and putting them to bed has been calming for the girls. It's been good for them, and we've made a conscious effort to be able to do that over the last week because although friends and family are around to help, in some ways having them there to do the things with the girls was confusing for them. Obviously friends and family are still there, but they need to see me more particularly. So that's helped overall. The girls have definitely been calmer this week, and I've tried to have some quality time with them as well, and you might see that we did a fairy day, which is on here as well. And in terms of Ross, he has had the district nurses come out, the palliative care team, and they've assessed Ross and see how he is. Most of the time he has been in bed. His energy is so low that even just going to the toilet is difficult, like just walking to the toilet. His balance is really off, and that makes it really difficult for him. So we have moved everything downstairs, so his bedroom's downstairs, and everything's around, like we've got stuff. Obviously we would like him to be able to get up, and we encouraging him to go and sit in the garden and things like that. However, he doesn't really want to, and it's tricky because you kind of have to respect that. But I don't know if is it a selfish part, or is it, I don't know, but it's maybe like okay, so the video cut off. So what I was saying is that it's hard to know whether, I mean, we want him to move and stuff, but it's like, is it because we don't like seeing him in bed because he's quite comfy, and he wants to be there, and it's hard for him to get up, and I don't know if it's just harder for us, so we want to see him doing things that are normal stuff, like being out in the sun and things like that. The palliative care nurse did ask whether, try and encourage him to go out, and he went, I'm allowed to be comfortable, and Anna, and she was like, well, yeah, and he was like, okay then. It's hard at all of this because we're trying to get a balance for, Ross's dignity and knowing who Ross is. Now, I know who Ross is, and those of you who know Ross personally will know that Ross is he's a really strong character. He's sharp as anything, dry to the point of like he's weird and will say exactly what he thinks, often upsetting people, often making people feel wonderful because he says how he sees it, and he's always been the way he wants to be, and no F's given for anything that he does. So that makes it harder to see Ross in such a vulnerable position. It's different when he's with me, just me, because I've seen Ross in every vulnerable situation. I've seen him, at his lowest. I've seen him in all those, and so it's not as weird for me. I can do things and he'll take it from me to an extent, but it's hard that because now it's not just, it's also a physical thing where I can't, this morning he got into a position face down on the bed where he was comfortable for about 5 minutes, and then he wasn't, but me physically lifting him is really nearly impossible, like without actually hurting him. So then it's a case of like 20 minutes, half an hour of me trying to work ways of getting him to move a bit so I can make him move him safely. Now, yes, you could go, well, just get somebody in, but Ross is still alert enough to not want that to happen. So that's hard for me. Like, it's quite emotional that one, because I'm trying to get the balance of just making him have his own dignity and the things that he wants, and you know, and keeping him safe. And it's hard because Ross's judgment is not right, and it's actually hard for me to get used to that, because I've always trusted Ross implicitly in his judgment, because he's a smart bloke and I respect him, and I love him and trust his judgment. So it's actually weird to kind of go, you're not right and you're not going to be right most of the time. But then I find that balance of giving him some choices, however small. We're battling daily with getting tablets into him because he just doesn't want to keep taking them, and I understand that. We had a care team come out yesterday. I will withhold my thoughts on how that's going to help me till the next few days. I'm not sure it will. I think there may be a different route we have to go down, because having somebody try and fit into your life when, yeah, it's hard. That's hard. You know, I you know, friends and family have been unbelievable. You are unbelievable, all of you. But it's just finding our new normal for now. Ross has started some chemo, so they have been a little bit more active, and they're trying him on this for 5 days. He's taken that, and then we assess in a month, which, you know, in some ways, even the fact that we're saying a month, 3 months. They said we will scan in 3 months. That to me is not 3 months. We weren't discussing. So now that feels like, okay. We went to London on Friday. We took Ross to London. It was pretty hard work. To meet with a neurosurgeon down there and a private practice. So we went down and they were very good. They went through all the scans with us, and from the very beginning. That was pretty hard to see, because we got to see Ross's most recent scan, which made me feel a bit sick, to be honest, because it's spread right across the front, and it started around at the back as well, and in the centre of the brain. What they said, what this neurosurgeon said is he wouldn't, you know, he said, you know, you've kind of, he advised the chemo that we want, so he sort of backed up what the oncologist had said, which I guess is a good thing. You feel like then you sort of trust in somebody. He looked at Ross's state and whether he could, and how strong he is, whether he could withstand another surgery, whether that would be beneficial, whether he could do that awake. Sometimes they do that, and he didn't feel that he would be strong enough. Immune therapy, all of those things, he's just not strong enough. And we can shoulda, woulda, coulda until we make ourselves sick about what we might have done before. But we also have to understand that Ross is, up until the last month, has been fully aware, you know, of cognitively fine, and he wanted certain things and he didn't want certain things. And it is also not my journey solely. I have my own journey. Ross has his own journey. Equally does his mom and his family. And Ross has to have his own decisions on things. And he has not at any stage wanted to be flying all over the place, trying things on a whim. He just hasn't. And so we can't sit here. We're not experts in this. We don't know. But we went down. Ross was happy to try and see what they said, and they pretty much backed up what was said. He said, I would advise either doing nothing and spending time with your family, try the chemo, see how you get on with his chemo, temozolomide, see how you get on with that, and yeah, he said he would only suggest surgery if it was causing pain at the front of Ross's head and the pressure was getting to him, which it's not at this stage, but he wasn't suggesting that. Yeah, so we're getting there. We're just taking it as it comes. I feel okay. Sometimes I'm upset, but I'm trying to just trying to focus on right now and the next stages. And yeah, that's where we're at. It's not easy seeing Ross like this, because it's just not who he is, and it's very hard as people, with anyone who's had brain injuries or dementia and things like that, the people in their family, it's really hard to see. It's not just like normal cancer where somebody gets sick in their bed, it's just watching bits of them go in front of your eyes, and that's hard. But there are still bits of him there, so while that is the case, then we do whatever we can, and I'm doing whatever I can. And I thank everybody that's around us for supporting, because again, you're amazing. And it goes without saying, I know, but thank you. And thank you for your well wishes and support, and hopefully, yeah, this helps other people that are on a similar journey. I know I get messages off a lot of you, and at some point I sort of feel like this may be useful to the girls to look back on and understand what we did and what we didn't do. Yeah, cheers. See you soon.